All right, it's a beautiful Sunday evening. Good evening and welcome to Iron Port here on Metropolitan Television. Iron Port is proudly brought to you by the Ghana Revenue Authority, GWEL PLC, Serene Insurance, Ghana Link Network Services, Meridian Port Services, MPS, and indeed Phoenix Insurance. The show is proudly powered by the Ghana Ports and Harbours Authority-GPHA. And our media partner on this journey of a lifetime is the Business and Financial Times, the BNFT. Now, if you want to have a grasp of all that transpired on the show tonight, make a date and grab the Thursday edition of the BNFT, and you'll be able to see all that happened here on the show tonight. Tonight, we're streaming live on our social media pages. On Facebook, we are live at Ghana Ports and Harbours Authority. Ghana Ports and Harbours Authority. Still on Facebook, we are live at Port of Tema, and on YouTube, we are streaming live at Iron Port. Indeed, we shall be getting interactive with you, and so all you have to do is grab your phones, relax, and send us your messages and comments via our dedicated WhatsApp line, which is 0538-037353. 0538-037353. Now, when the time is ripe and I pick signals from the production team, which will activate the phone lines for you to call in and contribute to the discussion. My name is Kennedy Mona. We are going for a quick break. When we return, we'll continue the show. Please stay with us.
Good energy brings you quality choices with Goil Super XP. Available in many Goil stations nationwide. It is fortified with special additives that help your engine perform better and use less fuel. Branch into a Goil station today and energize your ride with Goil Super XP, compatible with most vehicles. Goil Super XP, Wufilia, huh? Wubefi. Goil, good energy. Ja, ya, ya.
Electricity, then pay your taxes. Yeah. Our taxes, our future.
Because you see, without our taxes, we wouldn't have good roads, good schools, better hospitals, street lights, and other very important social amenities. When we pay our taxes, we give our children free and quality education. Talga, my money too small. Why should I pay my tax? Look, small. Salifo, it doesn't matter how small or big your business or income is, you still have to pay your taxes. The little taxes from each and every one of us, when put together, could give your community clean water or that deprived school with tables and chairs. Please pay your taxes. It is your responsibility. It is your civic duty. It is the law.
MPS Terminal 3 is Africa's new state-of-the-art container terminal at Tema Port. For manufacturers, agro-processors and traders, the new port means business can be done faster. This infrastructure boost will improve Ghana's port handling capacity, connect more trading routes, and oil the engine of growth for the economy, creating greater opportunities across all sectors as Africa's markets merge and become the largest trading bloc globally. MPS, we connect, you thrive.
Business and life can be like the sea sometimes. Sometimes serene, sometimes calm, sometimes turbulent, and at times it brings the unexpected. However it is like, trust Phoenix Insurance for your home, car, business, and marine insurance needs. Call 0302-246-319 or 0243 690-492.
At Phoenix, you experience a delightful service delivered with wisdom.
Take a look at happenings in the port and shipping industry during the week.
In a bid to strengthen bilateral trade relations between Ghana and Burkina Faso, the Acting Director General of the Ghana Ports and Harbours Authority, Brigadier General Paul Seydou Tanye-Kunlonu, received a high-level delegation from the government of Burkina Faso at the authority's headquarters. The delegation, led by Ghana's Special Envoy to the Alliance of Sahel States, Colonel Larry Bevrolate, included Burkina Faso's Minister of Industry, Commerce and Handicrafts, Serge Poda, Minister of Energy and Mines, Yakuba Zabre, Minister of Environment, Water and Sanitation, Monsieur Roger Barrow, and the Burkina Faso Ambassador to Ghana, His Excellency David Cabre. Key stakeholders from various sectors of the Burkinabe economy were also in attendance. The delegation averred that they are resolute to ensuring that Ghana's ports remain the preferred ports for Burkina Faso and the Alliance of Sahel States at large.
How can the authority also facilitate the transit operation that is using the Ghana Port and Harbours Authority corridor?
Brigadier General Tanye-Kunlonu assured the delegation of GPHA's full commitment to promoting trade growth and improving the economic well-being of citizens in both nations.
I would like to assure you that we will do whatever it takes to make sure that the vision that our two leaders have for our people in terms of how to boost trade, to ensure that the standard of living of both citizens increases within the shortest possible. We'll be visiting your country and then the Niger and Mali to see how best we can enhance collaboration and then increase the transit business. So we'll do what we have to do to make you more comfortable.
He also underscored ongoing efforts to reduce the cost of doing business at Ghana's ports, revealing that discussions with customs and other key stakeholders are underway to implement a 24-hour operational system within the clearance chain. Ghana's Special Envoy to the Alliance of Sahel States, Colonel Larry Bevrolate, emphasized President John Dramani Mahame's commitment to strengthen bilateral ties with Burkina Faso, Mali and Niger. He urged all parties to play their respective roles effectively to ensure the success of these collaborative efforts in improving the standard of living in the region.
I want to emphasize that the President of Ghana
et le président du Burkina Faso
have sat down themselves to building very strong bilateral relations
et se sont engagés sur de faire en place.
So I just want to urge everybody to play his role, not only to do the thing that you have been asked to do, but to help in the thinking that will contribute initiatives
qui va contribuer sur la
The Director General of the Ghana Port and Harbours Authority, GPHA, Brigadier General Paul Seydou Tanye-Kunlonu, has urged stakeholders to collaborate in reducing the cost of doing business in Ghana's ports. According to him, this initiative will enhance the country's port attractiveness and competitiveness within the West African sub-region. He made these remarks during a working visit by the Commissioner General of the Ghana Revenue Authority, GRA, Anthony Sapon, and his team to the GPHA. The visit aimed to reinforce the long-standing collaboration between the two institutions to improve cargo clearance, facilitate trade, and boost revenue generation. Brigadier General Tanye-Kunlonu emphasized that only through strong collaboration can both organizations effectively achieve their goals.
We'll continue to collaborate, work together, and then also explore new areas that we can collaborate so that at the end of the day we can increase the revenue basket of the country. It is our aim to ensure that the cost of doing business here will be as low as possible by reducing delays.
Echoing this sentiment, the Commissioner General reaffirmed GRA's commitment to strengthening its partnership with GPHA. He noted that enhancing this cooperation would significantly improve port operations and state revenue mobilization.
What you do and what we do at GRA is very, very important for national development. Although we do have different mandates and different functions, if we don't put synergy in, we will not be able to maximize the benefits and the results that we have. and therefore for us as GRA, it was important to pay this visit.
He also expressed his appreciation to the GPHA Director General and his management team for their years of productive collaboration. He encouraged continued teamwork in the national interest and in support of President John Dramani Maham's reset vision. In a related development, the Commissioner General and his delegation also visited Meridian Port Services MPS Limited, where they engaged with the CEO, Mohammed Samara. The visit aimed to strengthen collaboration toward enhancing government revenue. During the engagement, Mohammed Samara stated that the significant investments in port infrastructure at MPS Terminal 3 of the Port of Tema is contributing immensely toward efficient delivery of cargo to customers.
So it's quite important, this transshipment. The other side of it, this created a feeder service from here eastwards and from here westward. So that means we have opened up markets. Before, to ship to Dakar, you need to send a container to Algeciras for another ship to take it from Algeciras to Dakar. Today, from here, there is a weekly service to Dakar. Douala, likewise. Lagos, likewise. Today, we have services going to these ports on a weekly service.
The Commissioner General of the Ghana Revenue Authority, GRA, Anthony Sapon, along with his management team, held a deba with officers of the Tema collection of the Customs Division of GRA. The deba provided an opportunity for the Commissioner General to gain first-hand insight into their working conditions and to motivate the officers. Addressing the gathering, the Assistant Commissioner of the Tema Collection, Teresa Potaki, revealed that in the previous year, the Tema Collection was responsible for 82.09% of the customs revenue targets. It made a significant contribution to national revenue by collecting a total of 36.8 billion Ghana cedis, exceeding its targets by 8.6%. She further disclosed that from the beginning of 2025 to Wednesday, March 12, 2025, the Tema collection has already collected 7.9 billion Ghana cedis, while awaiting its official revenue target for the year.
This figure, as compared to the revenue collected during the same period last year, is in excess of 43.22%. We are committed to working tirelessly to achieve our targets and exceed it.
The Commissioner of Customs, Brigadier General Zibrim Ayorogo, acknowledged the critical role of the Customs Division in revenue mobilization and urged officers of the Tema collection to remain committed to achieving this year's targets.
Without you, if you don't cross the line, we don't make it. But I want you to assure me and assure our Commissioner General that inshallah, the target will achieve that.
The Commissioner General, Anthony Sapon, assured customs officials of improved working conditions to enable them to effectively perform their duties and contribute towards achieving the 200 billion Ghana cedi revenue target set for the GRA.
That if we want to build a better and a stronger authority, GRA, then people matter and people's issues should be at the top of everything that we do. It is only when we make people matters number one that we can say we are building an institution. And then when we build a strong institution, then the revenue will follow, plus all other things. So
the Director General of the Ghana Ports and Harbours Authority, Brigadier General Paul Seydou Tanya Kulono, has assured staff of the authority of fair treatment and transparency under his leadership. Addressing junior staff of the authority at Edeba on Tuesday, Brigadier General Tanya Kulono encouraged staff to uphold hard work and discipline, stressing that these values are essential in achieving GPHA's strategic goals for the year. According to him, improved performance will ultimately contribute to increased profitability, which will reflect in better working conditions for employees.
It is our responsibility to ensure that the assets of GPHA are protected So if wherever you are, make sure that the right thing is done. Let's work hard, we'll be committed, let's be disciplined, and as I indicated, promotion will be based on fairness, it will be transparent, it will be equitable, based on performance.
All right, so welcome back. Those were happenings in the port and shipping industry for tonight. Tonight we are pressed for time, and so pardon us if we don't come your way with the word or phrase of the day and the health tip for the day. In any way, we're going to start on a health note, and this comes on the heels of, 20th of this month being World Oral Health Day. World Oral Health Day. And so we've assembled a team to help us, assimilate and, as it were, comprehend some of the issues, that has to do with our oral health. Now it's by way of cleaning our mouth and all that. And so let me introduce to us Dr. Alexander Wusu, who is a dental surgeon and a public health specialist. Good evening, sir, Doc, and welcome.
Good evening, thank you.
Good to have you in our studios.
Great to be here.
And indeed, we also have with us Dr. Mensah Tabiamankwa, who is a dental surgeon at the International Maritime Hospital, IMA. Good evening, sir, Doc, and welcome.
Good evening.
Awesome. So first of all, tell us, when one says oral health, what do we mean?
Thank you, Mr. Mona. I would start off by sending big greetings to my CEO,
right,
Dr. Kwesefri Champong, Dr. Becky, and the rest of the team at IMA. When we talk oral health, it's big. It's a broad term.
Right.
It's everything that has to do with the mouth, the teeth, and the related structures. So immediately you begin to think of three things.
Right.
The gum, the teeth, the tongue. But there are other structures that are closely related. You have connections close to the brain, connections to the throat, connections to the eye. So that is the starting point when you begin to speak about the oral region.
Right.
But when you look at our work, the space that we operate, it is everything within the face. We just don't cross into the throat. That's the ENT's jurisdiction. So oral health would then include the health care that covers all these structures in relation to the general health of an individual.
Right.
Yes.
All right. So if you can tell us the impact of oral health and how it is important, how do we appreciate the need to keep, our oral health, to take our oral health seriously?
Okay. So typically I would have a picture to better explain this. So if your team can put up my favorite picture for me, that would help.
Okay.
But it is the window to the body in very simple terms. I know other specialties will come after me for saying that the mouth is the window to the body.
Okay,
but
so that's a picture.
Yes, great. Yeah. So I'm sure at this point you and your viewers are wondering. But Mr. Mona, I would like to pick your brain. What do you see first when you look at the picture?
Gap in the mouth of the man.
Great. You see that he's missing the tooth, and the rest of the family has very beautiful smiles.
Absolutely.
But it would also interest you to know that on the same side he's missing the tooth, he's missing an eyebrow.
Okay. Yes. Absolutely. That's
great.
Right. Sure.
So this usually would drive home my point that when you're speaking oral health, it starts from the outside and works its way into the inside, and with all its links to other systems of the body.
Right.
The middle third of the face is the part that everybody looks like at when they are talking to you.
That's right.
So if the first part, which is the appearance, the aesthetic, is not great, then already you know that the person's confidence, ability to express themselves, great smiles, all that is going. That's the first part.
Yes.
But the infections and the diseases that come with it also closely relate to all other systems. Let me ask you another question. Think of how many times you've had sauce in your mouth, and how many times you've observed scars in your mouth compared to other parts of the body.
That's true.
It should tell you that the mouth is a very special place.
Right.
Highly vascularized, highly regenerative. So the blood from there is moving to all parts of the body as it were. So if you're not taking good care of the mouth, then invariably all other systems are being affected. I'm sure as the conversation progresses, we can delve into specific conditions and their bidirectional relationship with conditions that affect the mouth.
Right. Okay, so let me come to Dr. Ansonwusu and find out from you if you can tell us the most common oral health issues you encounter at IMA.
All right, so generally, if you look at attendance to dental clinics, the most prevalent conditions that bring people are mostly dental caries, number one, followed by gingival diseases. So gingival disease, we are looking at gingivitis, we are looking at periodontitis. As we go on, we explain what exactly these are. But these are the main things that bring people to the dental clinic. There are so many others, but most people come because of sequelae or a sequence of dental caries.
Right.
Interestingly, most people come at the very terminal end of it. I don't know what scope you will have to, the time you have to go into the details.
Right.
But dental caries starts from just the enamel, then it progresses to the second layer in the tooth, dentin, then gets to the living part, that's the pulp. Most people will come when the decay has gotten to the living part, so they present with pain. And that's an issue that probably we want to touch on as we go on. So that people do not only come to the dentist when they are in pain. That is what brings most people. And the sequelae progresses from just the toothache. You can have swellings of the jaw. You can have swelling that...
Sometimes the gums.
Yes, the gum, swelling the entire jaw, and it can cross bilaterally to a very common condition that may lead to death called Lodrick's angina. It may spread to an infection that will go down the entire neck to the chest, and the sequelae can go on and on and on.
Right.
But most people present either as a result of a sequelae of dental caries or tooth decay or cavities, or various forms of gingival diseases, bleeding gum, swollen gums, bad breath. But aside these, there are other things that bring people to the dental clinic. We have people presenting with, commonly people come with tooth sensitivity.
Yes.
Now, tooth sensitivity could be caused by a myriad of things.
Right.
But one of the very common ones is, once again, tooth decay at a particular stage. When the decay is just within the dentin or the second layer, it may present to some level of sensitivity.
Right.
People also present what we call cervical tooth surface loss. All it means is that there is wear of the part of the tooth closer to the gum. And once that wear goes deeper and deeper, they start having some level of sensitivity. Maybe as we go on, we may discuss what causes or what leads to that. So people also present, especially in children. Children may present with a special form of tooth decay called rampant caries, where they have the caries affecting so many teeth at the same time. And it tells you, the dentist, that this child is maintaining a very poor oral hygiene. This child is probably sleeping with the breast in the mouth, sleeping, taking a lot of drinks, sleeping with either breast milk or using sweetened pacifiers. And there's a lot we get from just looking into the mouth. You also have others that present with various forms of dental trauma. So various accidents that happen in the orofacial region. So people will come with a tooth that has been knocked out, a fractured tooth, various forms of lacerations. And then you have to look at managing the pain, managing function, and then managing aesthetics and restoring all these once again. I think also people present with bad breath. We have quite a number of people come in, and their main concern is that they have bad breath. Once again, you want to investigate what is causing the bad breath, and then once you handle that, then the bad breath may resolve. I think another thing people present to the dental clinic is when they have missing teeth and they want to restore it.
Right.
So this year, 2025, the World Oral Health Days team is looking at happy mouth, happy mind. Looking at the link between oral health and mental health. And this is a very big area. The link between oral health and mental health. So most people would come in face mask, not because of COVID, but because they have a missing tooth and they are not confident to walk around without their face mask. So then we have to look at various prostheses to replace the missing tooth, to give them back that confidence so they can go out there and perform wherever they find themselves. Others also present with not being happy with the way their teeth are arranged. So you have a number of people coming and they want to fix braces, or they are not happy.
That looks like it's become the order of the day, the fashion of the day. People use it as some form of fashion. Everybody wants to wear braces.
So that's a big issue. So we have those that are in braces done by professionals, orthodontists, or trained dentists to do it. And unfortunately, we have some quacks out there who fix these brackets and are not orthodontists. And that's another big issue for discussion. But when you see people in braces, generally, it's not just for the fashion of it, but it's mainly to correct how the teeth are arranged or how they are aligned.
Right. Okay, so let me come to Dr. Tabia Mankwa, and find out from you if there are any specific risk factors that increases the susceptibility, that's a mouthful, to dental problems in Ghana.
Well, this is not peculiar to Ghana alone, but we'll find a way to tie it in.
Right.
When it comes to caries or gum diseases or tooth cavities, you are thinking first time. You are thinking the diet, and you are thinking an available surface.
Right.
And of course, a host, a human being, and then the bacteria that will cause it. I know for a long time, to the general public, cavities has been shrouded, the cause of cavities has been shrouded, thinking it is very, very complex. But let's find a way to break it down.
Right.
You eat food that contains reducing sugars.
Right.
Refined sugar, high sugar diet, very, very sticky. It comes to contact with a tooth surface. And then now there is contact time for bacteria to act on these sugars and break it down. And a byproduct of that is acidic in nature.
Right.
So that softens the mineralized components of the teeth, which is the white part first, and then gradually works its way through the dentine, then to the living part that Dr. Ansan was talking about, which is the pulp.
Right.
And then the sequelae of infections begin. So one would think that, okay, then if I am cutting out high intake of refined sugar, brushing well, then that should suffice.
Absolutely.
But as Doc has clearly highlighted, that is not the only thing. Now, even the type of brush that you are using is a risk factor.
Right.
So it's not just about the diet. Using very hard tooth brushes is a risk factor for oral diseases. High alcohol consumption is a risk factor.
Smoking.
Definitely, they go hand in hand.
And sometimes the diet as well.
And the mechanism around it tends to be complex, but it's a major risk factor. Then other systemic diseases, diabetes, and then systemic conditions. These ones are not diseases. For example, pregnancy. It will predispose you to some things. I mentioned earlier that the mouth contains a lot of blood.
Absolutely.
So when you are pregnant and the hormones are high, then the pregnancy also contributes at that point. But in itself, it would not be termed as a risk factor for tooth loss. I've had a few patients come to me to say, Doc, whenever I'm pregnant, I lose a tooth. And this is something that has happened to my family. And they have a very, very fantastic explanation to it that I'm sure Doc knows.
Tracing
that's
back to
why.
family history or
Family
something?
history. My mother lost it. The fluid from the baby passed through my mouth, and that is why that happened. But it's all because the preventive measures
have not been taken seriously.
Weren't taken seriously. So when the hormonal components come in, it gets exacerbated, and then you see those outcomes. So top of my list will be high sugar diet, alcohol, smoking, and then use of some products. But since we are talking about oral conditions in general, I wanted to top up to what Doc said. The oral cancers.
Right.
They are also a menace. They are there in the numbers. It's not very typical in our setting, but at the referral centers, they see a lot more.
Right.
So all forms of oral cancers, really, and some of these have been attributed to smoking, alcohol use, among other things. And there are some other benign conditions. They are not cancers, but they come, some of which are aggressive. So if you are observing anything, regardless of the fact that it may be a familiar risk factor that is exposing you to that, the recommendation is that you see a dentist early. Because some of them, though requiring surgical intervention, can be handled quite early.
All right. So let's quickly, I think we can activate the phone lines briefly so that you can engage Doc if you are watching and you have an oral health issue or you want to ask a few questions. You can oblige Doc and Co so that they will proffer some solutions or responses to you, because they have barely 10 minutes or 12 minutes to leave us. And so if you have any question, I'm sure the phone number will be displayed on your screen so that they can call in and then ask Doc the questions that they want to ask. So let me come to Dr. and so on, and find out from you if there are any daily oral hygiene habits that we should follow as people. If I wake up in the morning, I know that the normal thing to do first of all is to brush my teeth. Sometimes I'm tempted to drink water before I brush my teeth. And then, that's the first thing that everybody normally should do. What's the daily routine in terms of handling our oral health as humans?
Thank you. So, looking at the risk factors that we've discussed already, and looking at the commonest condition that even bring people to the dental clinic, then it will inform what the common practices should be.
Right.
So, when we're looking at, I don't think we've discussed it, but looking at the time left, I don't know if you have time to look at that, but basically, saliva plays a key role in protecting our teeth and keeping our gums healthy. What saliva does is that it constantly rinses and cleanses around our teeth. But what we can do to help is what my colleague just did over there. Drinking a lot of water. It helps. Rinsing our mouths with water is very important. Everybody must make it a habit to rinse their mouth with water after every meal. Make it a part of you. If it's just plantain chips, if it's just biscuit, whatever it is, once you finish eating anything, rinse your mouth with water. We are not telling you to brush your teeth after every meal. No. What we are saying is that make it a habit to rinse your mouth with water after every meal. As simple as it is, it goes a long way to provide a lot of protection or contributes significantly to give you that healthy oral health we are discussing. That is one, rinsing your mouth with water. We encourage everyone to stop taking in fizzy drinks. Fizzy drinks do not do us a lot of goods.
You can mention, not brand names, but you can mention what fizzy drinks are so that people who are watching can appreciate.
Carbonated drinks, yes.
Drinks we find in tins, like cans.
Cans, bottles, carbonated.
And interestingly, people at the port and people on the sea tend to take a lot of these. They don't have a lot of proper food. They eat a lot of refined foods, take a lot of these fizzy drinks, and it doesn't help. It increases your risk of developing cavities very significantly. So we encourage that we all stop taking in fizzy drinks. Instead, you can take in a lot of fruits and drink a lot of water. We have a lot of our children going to school with a lot of these fizzy drinks in their lunch packs called their snacks and all that. We want to discourage this practice. Very important.
You discourage this practice. It's very important. You come back to that. But let's welcome Gabriel from Ashaiman. He has a question or a contribution. Good evening, sir.
Good evening, sir. Once again, please.
Awesome. Please go ahead.
Please, I would like to ask. One of my teeth, the jaw side which I used to chew. Yeah, I'm feeling some unusual feeling, and like as if when the upper teeth touches the down, I cannot. Yes, the pain is becoming
unbearable.
Something that I cannot even describe, and I want to know because all that the two doctors are saying, I am no one that takes too much sugar. Sometimes a week or even a month, I take sugar, just a teaspoonful.
But do you smoke?
Just one day in a tea. So
do you smoke?
Can they help me?
Do you smoke?
I don't smoke. I don't drink.
Okay, all right, that's fine. Sure, thank you very much. They would proffer some response to your question, please. Thank you, Gabby.
So we always want to let people know that it's not just about eating sugar. It's anything with carbohydrate in it, and he mentioned it. So it could be your normal plantain chips, your normal biscuit, the normal yam, the normal rice. Anything that you're eating that has carbohydrate in it is a substrate. And it can put you at risk of developing a cavity. So we are not saying that don't eat anything with carbohydrates, no. But we are saying that when you take these things with carbohydrate in between your major meals, then it increases your risk of developing cavities. So I noticed that most of the people working at the ports, people working at the market who do not have time to sit down to eat, but eat small meals in between, usually present with a lot of cavities. We don't want to bore you with the technicalities of exactly how the cavities form. But whenever you eat anything with carbohydrates, minerals leave your teeth. You've heard of calcium and fluoride ions. They leave the tooth, but saliva puts the minerals back. But if you're eating things with carbohydrate most of the time, then saliva does not have enough time to put minerals in. You have more minerals leaving than minerals coming back in, and then ultimately will progress to you getting a cavity. In his case, it could be a cavity that has formed. It could be, I don't know, he said that the tooth at the back. It could be a wisdom tooth that is giving him issue. That is another thing that brings people to the clinic.
Right.
Impacted wisdom teeth, and they come with a lot of inflammation or infection around the wisdom tooth.
Okay.
That could also be a cause. It could also be what we call the cervical tooth surface loss that has gone deep into the nerves.
Right.
Then it can also present with that level of pain.
Absolutely.
It could also be a gingival disease, periodontal that has progressed. The interesting thing about periodontal diseases, when they start, they don't present with pain.
They don't present with pain. Let's
have
go
the
to
pain.
Kumasi and come and you continue from there. Sorry to cut you in. Yes, but I understand Mike is calling us from Kumasi. Mike, good evening.
Pacho, good evening.
Pacho, who are there?
Pacho, Nyamiadumo.
Yeah, the Nyamiasim Pacho, without question.
Pacho, because every Kumasi, me gamuno, and hono.
Okay.
I'm an LP, me facial.
Okay.
And Pacho, me answer the movie every 1 month.
And the natural says, "Nipa no show when you out me say ugam no ahono." Okay. All right. Your doctor, why? That's it. Thank you.
In Mike's case, Michael, inti dia o no, and nona yesha si yedi kan no. Empempi no, nyoma mienu ana miensa na de beba. Either say wisdom tooth no. The last one there where che hono and infection e koso anase onya kaka bi o baby and akoswa ye infected and eba nanim eto dan so a eye tumor bi and for me because they all channel or patch say if we gum no ama na pie ni facial na che say ebo abontin a obi ehun. So once everybody is seeing that you have an obvious swelling, be it an infection, be it a tumor, whether cancerous or non-cancerous, that requires urgent attention. Inti Michael say uti we enye radio so nkomo ana TV so nkomo kra ochina na clinic bi e ben wo bia no e wo say utimi e bo homode na udru ho mai.
Yeah, right. Thank you very much, Doc. So yes, you finish up with your
Just a quick one on that as well. So just like my colleague mentioned, sometimes people will have these conditions, toothache, various pains, and they find their way to a pharmacy. They buy a pain medication, they buy antibiotics, and then they are fine for a period. Then it comes again. The focus of infection has not been dealt with. It's more like mopping the floor when you've not closed the tap.
Absolutely.
And this is very dangerous because I've seen a number of patients that present what we call osteomyelitis, chronic osteomyelitis. What it means is that the infection has been long-standing to the extent that now the bone itself is infected, and there's a lot of pus from the bone that has gone all the way even through to the skin. And you don't want to wait till that point. So once you start having any pain, just present to the clinic. In fact, you don't have to wait till there is pain. We encourage that everyone will visit. We are talking about protective and preventive habits. To visit the dentist very routinely for checkups.
Right.
Don't wait till there is pain before you go, as the practice has been. Sometimes people will come with pain. You address what is causing the pain. You find other things. So you tell them to come back for them, and they never come back. The next time you see them again is when there is another pain, and that habit is something that we shouldn't encourage.
Right.
Also, talking about preventive, habits, we encourage that we all brush twice every day, morning and evening. When you finish brushing at night, just spit out the paste. Don't rinse your mouth with water.
Okay.
We encourage that you use a toothpaste that contains fluoride.
Right.
Fluoride has been known to be one of the greatest public health findings in our century.
Right.
So using a toothpaste that contains fluoride is highly recommended. The fluoride puts minerals back into the teeth and then protects the teeth from cavities and other oral conditions. But when you rinse your mouth with a lot of water after brushing, you wash out most of the fluoride and very little is left to give you that protection. So at night, we encourage after brushing, just spit out the paste and then go to bed. Some people will brush and go and eat again and then they sleep. No.
Okay.
When you finish brushing at night, it means you are going to bed.
Some people are culprits. Okay.
So
let me go to Duenya and welcome Sami onto the line. Good evening, sir.
Good evening, boss.
Awesome. Please shoot. Please go ahead, Sami.
Okay.
Yes, sir.
Please, I'm having problem with my wisdom teeth.
Okay.
The last teeth, I have hole in my teeth for the past 12 years now. And when I'm chewing it pains me a little bit.
For the past 12 years?
Yeah.
Wow.
No, like for the past 12 years now when I was in school by then.
Okay. Okay. All right. Thank you. Doc,
and when I chew there, it pains me, and I've been to the hospital for filling.
Okay.
But it has moved and it's still there.
Right.
I don't know whether to move it or to leave it like that.
Okay. All right. Thank you very much, Sami. Thank you. Look.
All right, Sami. So to respond to your question, these days what we are doing is prophylactic. That is to say, we are being more preventive in our approach. For a lot of young people, we take out the wisdom tooth when we see that the potential for proper alignment into the mouth is lost.
Right.
We say it's impacted. We take it out to prevent some of these things from happening later in life. So once a filling has been done, if even the filling wasn't done right and there is leakage, there is bacteria in the mouth, there will definitely be food somewhere. So it will get reinfected. So this is not just to Sami. Every time you do a filling, and it's just not maybe sensitivity that is lasting a short period, but you are feeling pain, please go back to your dentist for something to be done about that. But generally, wisdom teeth are problematic.
Absolutely.
Especially when the angles are not right and there is gum covering it. So we recommend you come in, we will take it out. It is a minor surgical procedure. You don't have to go to the theater or sleep for it.
Okay.
We do it in a few days. You are back on track.
Okay. All right, Doc, I'll come back to you, but we're going to welcome Equia from Medina, who's going to be our last caller because we are pressed for time at the moment. When we come, I'll find out from you what you are doing at IMA, for World Oral Health Day on the 20th of this month. Good evening, Stepia.
Good evening, Doc.
Awesome. Hey, I'm not doctor. The doctors are here. Okay, yeah. So you are saying hello to the doctors.
Good evening.
Yeah, sure.
All right.
Yeah. Please go ahead.
My question is, me brush my teeth twice, like an opinion, but me brush it twice, so I be 2-3 months. Na me gum no air hono. Until me jai kakra. Until eba fama no masa ashasi.
Aden o jaya always so good Diana.
Bacho Devi.
Okay. All right. Fine.
Make sure every 3 months be also Mrs. Sammy brush. And after me teeth no. Minim say gum no na akosro and I say me teeth no na bad down.
Right.
I say gum na we say yes na I say lie be wonichi. Show baby I say gum me do. But me dey no gum no line no e form.
Right.
The person who say be a problem and I say baby I say me tell what I can.
Okay. All right. Thank you. Thank you very much indeed. Doc, if you provide a solution and then we come, or you want to
so
begin?
Doc will go, then I speak about oral health activities.
Okay. So what she's describing, okay,
classic.
Most people don't brush the right way. He has a bigger model.
Yes.
Most people brush to and fro this way.
Yeah.
Just go back and
instead of up and down.
So there are a lot of proper ways of brushing, but very simple ones that you can do is the method. So you point, he has a bigger model. So you point the brush towards the gum this way, then you roll it against the tooth and down.
Okay.
Instead of the back and forth.
Okay.
Back and forth has a lot of issues and we don't encourage it. So towards the gum, then you roll it away.
Okay.
Point, roll it against the tooth and out. Roll it against it. For the chewing surface, you can do the back and forth you love to do.
Right.
I mentioned earlier that gingival diseases do not present with pain. You have pain when they've gotten to the very terminal phases.
Yes.
So we encourage that you present to the clinic very early. If you're using, and people use hard bristled brushes, that's another thing we discourage.
Yeah, so you should
encourage
know the nature of your gum, and you get your brush according to that.
No. Everyone should use a medium hardness bristled brush. There are some few instances when we ask people to use a soft bristled brush, but most of the time, we encourage the use of a medium hardness bristled brush. And then change it. You don't wait for your bristles to get this way.
Right.
You must change your brush at least every 3 months. So if the bristles get distorted before the 3 months, you have to change the brush. We encourage our client or our caller to visit the nearest dental clinic.
Right.
She may need probably just a simple scaling and polishing. She just needs to go for the assessment. Based on what we find, we inform the treatment plan for her. But she shouldn't say that she's having pain, so she stopped brushing for a period till the pain
that
goes
may
out.
exacerbate the
you don't do that.
Okay.
You should visit the nearest dental clinic.
All right. So there are those who also believe that smokers and people who take a lot of coffee need to use the hard bristled brushes.
Smoker's brush.
Yes, the smoker's brush, that kind of thing. But
unfortunately, you can't display the pictures.
So You give us your final words. That's with respect to what you are doing at IMA for Oral Health Day.
I'll respond to that.
Yeah, okay, all right, sure.
Right.
Okay.
So, just a quick one on Akua's.
Yes.
I would say that Akua would have been a very good dentist. Her level of observation is very good because she's telling us
the
that...
description is vivid.
Yes, the gum was here and now she's noticed that it's gone down. She wants to know. Akua is not normal. The gum has gone down because most likely there is gingival or gum condition going on. So she mentioned that it gets swollen and then she has to stop.
Right.
So doc has put out something there for her that cleaning would help. But if she goes and they notice that because Akua was brushing this hard this way, she's lost some of the tooth tissue that is covering the surface, then beyond the cleaning, they are also going to fill it up. And where she requires more advanced treatment, it will be done. So Akua, please, tomorrow your dentist will be waiting for you.
Absolutely.
Yes.
Absolutely.
Back to IMA.
Yes.
For us, World Oral Health Month, the month of March, is just an opportunity for us to enhance the message about basic, simple techniques that will help you keep your teeth. And Mr. Mona, you know that we say the older generation takes care of their young ones for them to grow teeth, and then the younger will take care of the old to lose teeth. But you don't have to lose your teeth.
Absolutely.
If you are visiting us, you are visiting your dentist routinely, you don't have to lose any tooth. So in this month, just like every other month that we are doing, our doors are open. We work every day of the week, including Sundays. You can call in, book an appointment. You come in, you have a thorough assessment done, and then through our partners, you may even get a souvenir home. That is for the month of March. Some of our partners, I don't want to put on air, but they are willing to support in that regard. Primarily, we just want the message to get out there, and your platform is giving us the opportunity for it to get out there. Let us see you twice a year for your routine visit. Let us help you change your toothbrush. If you think, I encourage my patients that when you are coming to me, bring your toothbrush along. Let me decide for you whether it's hard or soft. Because sometimes our idea of, oh, doc, it's not too hard, it varies. So bring it along. Don't be shy. Just bring it. If even it looks like hair that has been parted, bring it along. We may be motivated to give you one for the road. Yes.
All right. Thank you very much indeed, Doc. My takeaway or my take home is the fact that when you brush in the night, when you're going to sleep, leave the fluoride. Don't wash it with water. Just leave it like that, and it protects your teeth. And so please take note. That's my takeaway or take home. With mouthwashes, do you encourage that for people to use mouthwash? There are some people who believe that if even they don't brush and they use the mouthwash, they are good to go. Just the last one, we have barely 30 seconds.
So one of my mates back in dental school did a study on mouthwashes, and it was interesting what he found. There were people who are doing exactly what he said. They feel that the mouthwash is a perfect substitute for their brushing, which is very wrong. A big no to that. The mouthwash is not a substitute for toothbrushing. There are instances when, after we do your professional cleaning, we may put you on specific mouthwashes, chlorhexidine-based mouthwashes, that we may ask you to use it for just 2 weeks, and then that is it. But people may have certain mouthwashes that they may be on for us, and sometimes you ask someone to use a mouthwash for 2 weeks, so the way it held me, I want to continue using it, and then they keep on using it. That is not what we encourage. So mouthwashes are not a substitute for toothbrushing. Definitely not.
I think this topic is a topic on its own that we have to treat full program. I mean, there's no two ways about it. Considering the interest that is elicited or generated from those that called in and those that are watching. And so we'd like to say a big thanks to you, Dr. Alex Ansonwusu, dental surgeon and public health specialist, International Maritime Hospital here that's in Tema, and indeed to Dr. Mensah Tabi Amankwa, who's also a dental surgeon at the International Maritime Hospital. We're grateful to you, docs, for making it to the studio tonight for our report. We're grateful, and we'll take note of what you've said about what you're doing.
Mr. Mona, a quick one.
World Oral Health Day.
Please, dentistry is not for the rich. preventing it is way cheaper
than
curing.
treating.
So let's take that home.
Absolutely.
Right.
Thank you very much. So viewers, yes.
Subdental, not maritime.
Subdental, okay, yes. Subdental also in Tema. Absolutely. Thank you very much indeed. Yes, so viewers, we're going for a quick break. When we return, we'll come and introduce our second subject or topic for tonight, and then we shall be underway. Please stay with us.
Good energy brings you quality choices with Goil Super XP. Available in many Goil stations nationwide. It is fortified with special additives that help your engine perform better and use less fuel. Branch into a Goil station today and energize your ride with Goil Super XP, compatible with most vehicles. Goil Super XP will fill ya, huh? Will be feel. Goil, good energy. Yeah, yeah, yeah.
Electricity, then pay your taxes. Yeah. Our taxes, our future.
Because you see, without our taxes, we wouldn't have good roads, good schools, better hospitals, street lights, and other very important social amenities. When we pay our taxes, we give our children free and quality education. Tell God, my money too small, why should I pay my tax? Look, small. Salifo, it doesn't matter how small or big your business or income is, you still have to pay your taxes. The little taxes from each and every one of us, when put together, could give your community clean water or that deprived school with tables and chairs. Please pay your taxes. It is your responsibility. It is your civic duty. It is the law.
MPS Terminal 3 is Africa's new state-of-the-art container terminal at Tema Port. For manufacturers, agro-processors and traders, the new port means business can be done faster. This infrastructure boost will improve Ghana's port handling capacity, connect more trading routes, and oil the engine of growth for the economy, creating greater opportunities across all sectors as Africa's markets merge and become the largest trading bloc globally. MPS, we connect, you thrive.
Business and life can be like the sea sometimes. Sometimes serene, sometimes calm, sometimes turbulent, and at times it brings the unexpected. However it is like, trust Phoenix Insurance for your home, car, business, and marine insurance needs. Call 0302-246-319 or 0243-690-492.
At Phoenix, you experience a delightful service delivered with wisdom.
You're welcome back. We are zooming into our second discussion for tonight, and this was a topic we treated about 3 weeks ago, and that has to do with how to identify legitimate freight forwarder in order to avoid being exploited by the unscrupulous ones out there. And when we were having that discussion, we had in the studios Mr. Jacob Ajiman, who's chair of the Public Relations Committee, Ghana Institute of Freight Forwarders, Tema. Good evening, sir, and welcome once again.
Good evening, thank you.
Awesome. And then we also had in the studios Mr. Abel Tojo, who is a member of the Monitoring Committee, GPHA Tema. Welcome, sir, once again.
Thank you, sir.
Absolutely. So let me come to Mr. Ajimai. If you can walk us through the basics, what we discussed the last time. We talked about what a freight forwarder does. You walked us through, the rules. You gave us the distinction between the freight forwarder and the clearing agent, and all that. And then we also talked about the key responsibilities of a freight forwarder in international trade. And then we talked about legal requirements should a freight forwarder meet, legal requirements a freight forwarder should meet in order to operate as a legal entity, and so on and so forth. So if you can walk us through, just give us a brief, and then we zoom into...
In summary, the last time we said that the freight forwarder is the architect of trade.
Right.
He is the person to see to the whole logistics chain to make sure that everything is properly done.
Yes.
We're able to differentiate between who a freight forwarder is and who a customs house agent is.
Yes, yeah.
And I made a statement that custom house agency is just a subset of freight forwarding.
Yes.
So freight forwarding is a bigger picture, a bigger subject with which we have the customs house agency.
Yes.
And in our part of the world, Ghana, clearing agency or the customs house agency is more popular, so we tend to mix it up and just call them clearing agents. But beyond clearing agency, we have the freight forwarding, which is the bigger picture. And then with the legal requirement to operate in Ghana general as a business entity, you need to register the Register General Department.
Absolutely.
After going through that, specifically as a customs house agency, you must be licensed by the Customs Division of the GRA to operate as a customs house agent. And to identify customs house agents properly, we have various associations that they belong to, either GIF, which we are members, that's Ghana Institute of Freight Forwarders, we have QBAC, we have ACHAG, we have FAG. These are various associations that if a customer wants to deal with the customs house agent, you must ascertain the association they belong to. You can ascertain the genuineness of that agency also by contacting the PMP division of customs, so that they will tell you whether this company is valid and they are in the right position to function.
Right.
So when you look at all these things, it will help you identify or reasonably identify a customs house agent. When you get to the office, look for the necessary certifications and registration. If he claims to be a member of a particular association, there must be proof of that membership. And then we also said something about red flags.
Yes.
That the quest for too much cheap or cheaper service is the being or the basis for people being swindled or being cheated almost all the time.
Yes.
So we advise that when you're dealing with freight forwarders, clearing agents, customs house agents, I do not say that the service should be unnecessarily expensive, but it should be competitive and it should be reasonable. And you shouldn't fall for too much sweet words. Do a lot of due diligence yourself as a business entity, because you are involved in money and you are dashing out money. So if you do not do due diligence by yourself to protect your interest, it wouldn't help you.
Absolutely.
I think in the summary, this is what we discussed the last time.
Yeah, so let's zoom in today and find out from you in terms of experience and credibility, Mr. Tojo. How important is industry experience when selecting a freight forwarder?
Thank you. It's very, very important. It's extremely important because basically, I would say that's the fundamental. Without experience, you cannot deliver because you need to have that exposure to be able to tell the requisite document, the requisite mode to deliver the said cargo, and then also whether you're going to use a container, the forms of containers. As you know, we have reefer containers, we have dry containers, or whether you're going to ship the cargo in bulk or a flat track. You need to have. If you don't have experience, you will not be able to determine which CPC codes to use. And all of that. So you need to know all of that to be able to operate as a freight forwarder.
Let's take a look at the credentials or memberships should a reliable freight forwarder have. We know you have the FIATA, the IATA, and then the rest. What should I be looking out for? The last time I recall, I mentioned if I enter your office, what certification should I be looking out for? And sometimes in Africa, we fail to ask, can I see your qualification? What do you have? Your level of expertise. What certifications do you have? But what should I be looking out for when I'm sourcing a freight forwarder?
If I'm allowed to touch a bit on the earlier question before I come to this. one key aspect of freight forwarding is advice and consultancy. And to be able to advise properly and give good consultancy, experience is inevitable.
It's key, yeah.
So, I think industry experience is very critical as a freight forwarder.
Right.
Now, back to your question. I think there's this Ghanaian attitude of too much respect. So sometimes when you are probing to find out about things of interest to you, you may be seen as disrespectful or arrogant.
Absolutely.
So because
it cuts across, because even in the health sector, when you visit a hospital, they take your blood pressure,
your biodata.
They don't want to tell you what and what is it. And you have no right to question the doctor if
I
the
don't
doctor
think
takes
it's
a decision
appropriate.
on your own life
You
and
have
health.
to.
You know?
You have to.
Yeah.
If you come to my office, question me. I'm going to deliver a service to you. So you need to question me and be comfortable that this person is the right person I'm
Because you're
dealing
spending
with.
money. You are procuring the services of a person. It's your money,
It's
and
your
you
money.
need the service done. Quality job. So it's
question me.
within your remit.
Hey, Jacob, you're a freight forwarder. Let me know your credentials. Okay, I am a member of Ghana Institute of Freight Forwarders. I'll give you evidence.
Right.
I am a member of, or I've been licensed by Customs Division of GRA. I give you evidence. I'm a member of FIATA. I give you evidence. My company is duly registered. I give evidence. I pay VAT. I give you evidence. These are documents that you need to see. And if you don't see them, please, you'll be putting yourself in a very, very big problem.
Right.
So I think that attitude of too much respect, they will say that, I'm being too nosy. Please, you are dealing with money. Be nosy. Know it. Find out. So these are basic things you can find out, and then I think it will help you clarify yourself for a lot of things.
Right.
Yes.
Are there any ways I can check, apart from maybe coming to your office to ask these questions that he just enumerated? Is there any way I can do some due diligence or background checks before I contact you?
Yes, very so much. You could just walk into any GRA office, especially Customs PMP office,
right?
At the head office, and then you can mention the company's name that you're trying to engage this company A, B, or C. You want to verify if this company is certified by them,
right?
And they'll be able to tell you and show you proof that truly this agency or this entity is registered with us.
Right.
You can again check with Registrar General because you use the TIN numbers to process BOEs and all of that. So you can verify as well, and then you can also go to the tax-paying office, the CTO offices, to verify if this company is really paying their taxes and then the SNIT as well. Because we need TCCs when you are doing renewals. You need TCCs.
TCCs. What's TCCs?
Tax clearance certificates.
Yes.
We get them from GRA.
Yes.
To do renewals.
Right.
You go to SNIT, you get your SNIT clearance certificate
Right.
to do renewals. So GPHA requires these, Customs require. Every regulatory body wants to see these things before a recommendation letter is even issued from GIF or any of the association bodies to be given to you. So even if you have these documents without a recommendation letter from the said association you belong to, Customs is not going to process your documents.
Okay. All right, so let's activate the phone line so that you can have enough time to call in. The number to dial will be shown right on your screen. You can call in and ask my guests in the studios, Mr. Jacob Ajibain and Mr. Abel Tojo, some questions if it borders on freight forwarding or import and export. Indeed, if you want to procure the services of a clearing agent or a freight forwarder, you would have to contact them. If you have any questions bothering you, please don't hesitate to call the line right there on your screen, 0245-834-980, and then they will be happy or more than happy to oblige you. So let me find out from you, in terms of service quality and reliability, what are the factors that businesses should consider when they are selecting a freight forwarder?
In addition to what Macaulay said, for us at GIF, you can go to our website at www.gifghana.com. .com, yes. www.gifghana.com. When you get there, you see all the companies that are in good standing. If I'm allowed to give our official line.
Oh, yes, why not? Yeah.
So you can go to, you can call 0303-200-266. 0303-200-266. These are ways to verify if somebody claims he's a member of Ghana Institute of Freight Forwarders GIF. You can verify it.
Right.
Now, in terms of service delivery,
The
credibility, quality of service,
what should I consider as a business in selecting a freight forwarder?
In shipping, there's a saying that our word, our bond.
Yeah.
So, for me to be credible, my word must be who I am. So, our word is our bond. So, one, look at how reliable the person in terms of what he promises to deliver. That is one. Two, the timeliness of the company. Because time turnaround in shipping is money. So any waste of time is loss of money or revenue. So the timeliness of the person to deliver. Look at the competencies of...
Timeliness and competencies. Please hold it there. When we come back, you would continue. Let's go to Ejumako and welcome Kojo. Good evening, sir.
Yeah, good evening. Thank you very much for the opportunity.
You're welcome, sir.
I want your panel to help me with this particular issue.
Right.
When I pay my duty, my agent pays the duty for me. Of course, there is an evidence I need to see. Maybe I can see that with a receipt or an entry, which will help me notice that the duty has been paid. But I want to find out, is it possible that with the icons, I can also see if indeed my duty has been paid or not? Or if it is possible, can you please help me with that? I need to know. And how will I even identify if the duty has been paid on the interface of icons?
Right.
Thank you. I hope my question is clear.
It is.
Okay.
Thank you, sir. Thank you. Right.
Okay, so I'd like to answer his question.
Yes.
First of all, if a BOE is processed, a tax bill is what is used to process the payment.
Right.
So there's a unique number, which is a tax bill number that is being used to process.
Right.
So, and then there's a BOE number. Once you log in into the portal, you'll be able to see whether duty has been paid or not.
Right.
There's a receipt in the system.
Yes.
So whoever enters that BOE number
Yeah.
or the receipt number would be able to identify that truly duty has been paid or not.
Okay.
So for me, if you don't have access to the system, you can just, when you walk to the bank, because I believe that you should be given the tax bill
Yes.
to pay your own duty wherever it is, so that you can verify, you went to the bank,
Yeah.
and then they can also confirm to that. Once it's paid, you don't necessarily even need to send a copy to your agent.
Yes.
Because he has a system, so he'll be able to see the receipt in the system that
Right.
really you've paid.
Right.
And then also you get an SMS notifying you that, as you may see, this amount, duty amount has been received by customs.
Right. Right.
Now, to add to that, when you pay the customs entry, there's a barcode on the customs entry. Scan it. If you scan it, the exact amount paid will come on your phone.
Okay.
So if ABC says your custom duty is 100,000 cedis, and you scan and there's a discrepancy, then there's a problem.
Okay.
Yes. So the moment you scan the barcode on the customs entry, it tells you the exact payment that has been made. Yes. Okay. That's the solution to that.
Right. So you were on
also
that point,
you look at the timeliness of the person, look at the competence, the experience, the exposure of the person. Some of us believe that, like the earlier question, industry knowledge is crucial. So for an agency to be that credible and reliable, these are things you need to look out for: the timeliness, the customer relation of the person, the competence, the industry knowledge is crucial. Because you see, when one does not understand the industry language, it becomes a challenge. How even custom agency processes started way back was because customs realized that most people in the industry did not understand their language. So they decided to train people to become proficient in their language. That is how come we have customs house agents. So that individual or company must have somebody who understands the language of customs. When it comes to processes, we have something called CPC. What is even CPC? Custom Procedure Codes. So when it gets to customs, for the ordinary person, I will tell you I'm doing transit, I'm doing transshipment, I'm doing export, I'm doing import. But I will use a code between himself and myself. I know what transaction I'm involved in. Because when we talk of export, we can have different forms of export. So depending on the code I'm dealing with, it will tell me the type of export I'm dealing with.
Right.
Same as import. So industry knowledge is key. These are things you need to look out for so that you can reasonably say that this business is credible, that you can deal with.
In this era of technology, is it not possible for you to have a system where, like you have the Uber or Yango or the app railing app services, the app hailing, ride hailing services, that when you pick somebody's car, the fellow drops you, then it comes. You give the fellow a star. I mean, they give 1, 2, 3, 4, 5 stars, and that tells you that maybe you are satisfied, very satisfied, extremely satisfied with the fellow service. Can't you put something like that in place in a website? The fellow is looking for a freight forwarder. The fellow logs in there, logs on, and then looks at the credentials of everybody, what the track record is, the fellow's work output. I mean, how people have rated a person, and then the fellow will be able to make a choice.
So yes. So example, if you go to some companies, or most companies, those who have websites, you will see that you would have some comments from either a client who's patronized their services before, and so you will be able to know this rating. Also with GIF, what we've done is that there are membership grades. So we have platinum, we have gold, we have silver. So you know that when somebody is in a platinum level, it tells you the level of competency and exposure the person has. If somebody is on a gold membership level, that also defines.
And when someone is on bronze.
When it's on bronze, you know. So it spells out itself for you to know that, okay, these are the category of people certified I'm able to deal with. And if you have any challenge at all, you can always reach out to the Secretariat. We have branches in Tema, Aflao, KIA, Takoradi, and Elubo. So it's not just Tema or Accra that you can find gift offices. We are across. So you can just walk to any of the districts and then verify any membership you want to.
Okay. So let's take a look at the issue of unexpected challenges, such as delays, customs issues, or even loss of cargo. How do you deal with some of these things? Because they happen in your industry. Yes.
I don't even see them as unexpected challenges, especially when it comes to delays. Because I believe delays are predictable. So I don't see them as unexpected. However, in an industry where there are so much or so many bottlenecks, where we have various industry players, where sometimes some of them renege on their responsibilities, delays do arise. Now, when delays arise, it brings or it increases the cost of doing business. One of the major challenges GIF we're having is we are pushing the GSA, that's the Ghana Shippers Authority, to enforce what you call an SLA, service line agreement, among all stakeholders because of this issue of delay in service delivery. Service line agreement, SLA.
Yes.
Now, we are pushing this agenda because a lot of times the freight forwarder happens to be the last resort that the client knows. So what the client knows is, agent is delaying me. The agent is delaying my job. For you know, it is a problem which currently, as you speak, even to transfer boxes from MPS terminal to Golden Jubilee terminal is headache. Big issue. It has nothing to do with the freight forwarder. However, the client doesn't know MPS terminal. The client doesn't know GPHA. The client doesn't know Golden Jubilee terminal. It is you, the freight forwarder, he or she knows.
Absolutely.
And when this cost arises, it is the client who bears the cost. Bear in mind, no business entity is Father Christmas. So the more the cost of the client, the more the cost of the commodity on the market. You and I will pay for that. So in order to solve these issues, we are pushing what you call SLA, service line agreement, so that between GPHA, MPS, freight forwarders, all the other agencies, FDA, whatever, wherever the delay arose or wherever delay comes from, whoever is responsible for that delay pays for that cost involved. That is one of the things we are doing to solve some of these issues. It's very important. And I mean, at this point, I'll use this platform to welcome the new GSA boss, Professor Jampo.
Yes.
He has started on a good note.
Right.
And we wish him well. We pray that some of these issues will be pushed critically so that it will help reduce the cost of doing business. That's one of the things we do. When it comes to cargo loss, you need to determine at what point did the cargo got lost, got pre-freight, or got damaged or destroyed. There are various things.
Let's go to East Legon and come on, return, you continue from there. We are welcoming Samuel. Good evening, sir.
Hi, good evening.
Awesome. Please shoot.
What the man is saying, well, some of it is true, some of it is not. There's too much corruption at the ports. It doesn't really make sense when you brought something into the country, you paying your duty and everything, and there's a custom officer who is like, if you don't pay this amount, you're not going to clear your goods. It distracts you. It's like it kills your spirit.
Have you personally experienced that before?
Several times, from Takoradi and Tema, several times. So I started bringing stuff in. It doesn't help when clearing agents, due to like corruption and due to like greediness and jealousy, just delays you. They'll just walk you about. There should be a system whereby you go in, you've got your bill of lading, you pay straight to the government coffers. You pay yourself. It should be that transparent. It should be that straightforward. You pay, clear your goods, and then walk on. It should be just straightforward. Every time Ghana, you're always lacking behind. It's not a good practice. It's not a good thing. Right. Anybody that brings stuff into the country is blessing the country, is benefiting the country. You understand what I'm saying?
Absolutely.
So it doesn't really add up. Whereby they make you feel like you are a victim, or like you something. Like they make you feel so bad bringing stuff into the country.
Yeah.
It does hurt and it's annoying. Trust me.
All right. Thank you very much indeed, Sammy, from East Legon. We're grateful. So Sammy's taking a bath.
Sammy, I like.
He's peeved.
You are peeved.
Yeah.
I'm sorry for whatever you've been through, but I don't think any professional freight forwarder or clearing agent will work out of jealousy.
He mentioned brothers from the other side.
I'm not here to speak on behalf of customs, so I won't enter that debate.
Absolutely.
However, I'm going to make a statement that may be a bit contradictory, but we need to assess ourselves as a people, as a nation, and begin to have a clear-cut way about it. Now, if Ghana Customs wants to do the job as customs, I dare say that it will be extremely difficult for cargo to exit the port. That is not in any way in defense. You see, the average Ghanaian, when he is shipping, he can tell you, I'm shipping maybe a container of rice. And because of our culture and the way we do our things, the little space left in the container,
you add several other things,
cooking oil.
And when they scrutinize the thing and they say this is not right, it becomes
you have a problem with that.
And so if the customs also wants to be strict, he won't allow these things to happen.
Responsibilities or responsibilities,
absolutely,
goods will not leave the port. But in the interest of trade facilitation, some of these things are relaxed. That is not to say that sometimes they also don't go to the extreme. That's what I'm saying, that I'm not here to defend customs. But as a people, this statement I've made, I think we should analyze it.
So that if you are consignee and you are shipping something into the country, and you say, I'm shipping boxes of soap, it should be strictly boxes of soap. Nothing,
but
no
to be honest,
discrepancy.
In most cases, it's not. I have dealt with a lot of customers. They will tell you, oh, it's A, B, C, D. And then after clearing the items, they will tell you, this is not in, this is not in, this is not in. And this is the same person that told that I don't even know the content of the item. But the same person is not telling you, this is not there, this is not there. And this usually happens when it is consolidated or groupage cargo. That mistakenly, his has probably been delivered to a different person. So upon proper investigation, it is brought back. But that same person initially will tell you, I don't know the content.
The content of the container.
So we should.
But when something is stolen, the fellow is able to identify that something is missing.
So, Sammy, I'm sorry for the challenges you've been through, but I think we should all be forthcoming. That's what I would say about it.
Absolutely.
Adding to what my brother just said. Again, Sammy, our apologies, but now with the ICOM systems, you can sit anywhere and pay your duties. And it is straightforward. There's nothing hidden anywhere. So I'm sorry, maybe I don't know who you dealt with, but you can always reach out to the host and then get our contact, and then we can see our best to help you or fix your issue.
Absolutely.
The truth of the matter is that you can pay your own duty. You don't need your agent to pay your duty for you.
Yeah.
No. So please, my apologies. Just reach out and then we'll fix your matter for you.
Right.
Again, we at KIF, our negotiated rates with GSA is available even on GSA website, on our website.
Okay.
So any member can see what our service charges are per each clearance.
Right.
If it is a container, 20 foot, the rates are there.
Yeah.
So it's clear. There's nothing hidden anywhere.
Right.
Because this is something that was negotiated between us and then the GSA, which is Ghana Shippers Authority.
Right.
And like my brother said, we always want to do the right thing.
Right thing, yeah.
Yes, because now Shippers Authority will not allow you, whatever it is, they are always in the space to make sure that we are all complying with the rules.
Yes. Okay, so transparency and tracking updates. As a freight forwarder, you have your client who has employed you or who has sought your services to do business for him. Whilst the good or the imports or the cargo is on the way, how are you able to get the fellow to track and know that, okay, yeah, this is where it is, you know, that kind of thing until it is delivered? We have barely 3 minutes to wrap up, though.
Ideally, technology should be involved here,
Absolutely,
but it also comes at cost.
Yes.
So to keep constantly tracking your cargo means you should be willing to pay for the tracking services.
Absolutely.
And I know there are tracking services. I'm not here to advertise for anybody, but there are tracking companies that are available that they will track your cargo at every point and give you details.
Right.
If you're willing to pay for it, the service is there to be delivered. Yes, it's there. There's no two ways about it. It's there.
If you are ready to pay for the tracking?
Oh, yes. We have people on our platform, GIF platform, that provide tracking of cargo from port till gets to final destination.
Okay.
There have been instances where cargoes have been diverted, but with the aid of our members who are into tracking, they are able to locate where the cargoes are.
Okay.
Yes.
Okay.
Yes.
You wanted to add something? Or the final one, common contractual pitfalls. Maybe if I'm contracting you to do business for me, what are the things that I should do so that I know that, I've secured the services, and if anything goes haywire or goes wrong, I hold you liable or responsible as a freight forwarder?
So for me, there should be, what is the job scope? First of all, you need to tell me the job scope you want.
Right.
And then we negotiate based on the scope. The rates are there. We agree on it.
Right.
There's example, there's a rate for a 20 foot, there's a rate for a 40 foot. If you have volumes, obviously, that standard rate is not going to apply to, say you have 100 containers compared to somebody who has one container. If, say, a 40 foot is service charge is 2,000, and you have 100 of that, of course, that 2,000 is not going to apply per container.
Right.
So these are things that you need to come out clearly. Once you state what the job scope is, the service is also, the rate will go by the service, and then taken care of.
Okay. So thank you so much, Mr. Abel Tojo, who is a member of the Monitoring Committee, Ghana Institute of Freight Forwarders, Tema, and indeed Mr. Jacob Ajimai, Chair, Public Relations, Ghana Institute of Freight Forwarders, Tema. I'm grateful to you for obliging us once again, and this is a discussion we should continue to have. Like I said the other time, the time flies when you're in the company of good people and having a good conversation. This is a very, very good topic, of public interest, and would wish that we would exhaust it some other time. We're grateful to you for showing up. We always call on you when the need arises. Viewers, this is how we draw the curtain on tonight's edition of Iron Port here on Metropolitan Television. Remember, the show is proudly sponsored by the Ghana Revenue Authority, GWEL PLC, Serene Insurance, Ghana Link Network Services, Meridian Port Services, and indeed Phoenix Insurance is powered by the Ghana Ports and Harbours Authority-GPHA. We entreat you to keep watching the rest of our programs here on Metro TV, and indeed expect next week that we shall bounce back with another wonderful edition, God being good, of Iron Port here. And indeed, the abridged version of Iron Port will be aired on Wednesday at 8:30 p.m. on Ghana Television. Make a date and watch that. Wish you a spell week ahead, and thank you so much for choosing us, and have a restful evening.